Good afternoon. My name is Alicia Forbes, and for today, I'm going to be performing Foley catheter insertion skill evaluation. Knock, knock. Come on in. Close the door behind me. Hi, good morning. My name is Alicia. I'm your nurse for today. May I have your name, please? Okay, and your date of birth. All right, I'm just going to double check on her ID bracelet. Okay, hi. Hi, Miss Davis. So the reason why I'm here today is because the provider has put in an order for you to have a Foley catheter inserted. Reason being is because you're retaining urine, and we want to get that urine out to make you feel more comfortable, right? So the procedure for this procedure, I'm gonna be working with your perineal area. I'm gonna insert a tube, catheter tube inside the urethra, which will be resting on your bladder in order for us to collect the urine sample. All right. Do you have any questions for me? Okay, no questions. Thank you so much. I'll be right back. Wash my hands and put on my gloves. First, I'm gonna pull her gown all the way out, and I'm gonna pull the gown up. Then I'm going to spread her legs. I'm gonna spread your legs a little bit so I can have a better view of your perineal area. Then I'm going to be placing in just a protective garment under your bottom. Can you lift up for me, please? Thank you. I'm gonna flex your knees as well. All right. Next, I'm gonna perform perineal care on the perineal area. Just make sure she's cleaned. All right. Then I'm gonna be gathering my. I'm gonna take off my gloves. Trash right beside me. Throw it in my trash can. And next, I'm gonna gather my Foley catheter kit. I have my Foley catheter kit right here. Next, I'm gonna be doing is taking it out of the packet and place it right here, right there. I'm gonna be opening the packet. First, I'm gonna put that out of my way. Next, first, I'm gonna grab the little tab and open the packet away from me without touching the inside of the packet. Next, the next tab away from me without touching the inside. Without touching the inside. The next side without touching the inside. And then the last piece towards me without touching the inside of the packet. Okay. Okay. Now that my packet is open, next I'm gonna take out my gloves. I'm gonna put it to the side. Next, I'm gonna be opening my gloves. My sterile gloves, that is. Wash my hands again. Opening my gloves. A little bit more. Opening the packet. Away. All right. I can touch it. I'm going to use my dominant hand to put on the first glove. Come on. First, I'm going to use my dominant hand, pick up my gloves from the inside without touching the outside of the gloves. And I'm going to use this hand. It's just only touching the inside of the glove. Pull it up, only touching on the inside. Okay, all right, this can stay like that for now. Then I'm gonna use the same sterile hand and put the other one on. Now this hand can touch the on the outside of the gloves. This hand is able to touch the outside of the gloves. Let's fix it a little bit. Okay, and I can use this hand to pull this one up as well on the outside. Now my hands are sterile, so I cannot touch anywhere else but only my sterile film. All right, I'm gonna pick up my packet. So this, I'm gonna make sure that the shiny part, there's a shiny part and there's a dark part. I'm gonna make sure the shiny part is facing downwards without touching my patient. So I fold it a little like that, and then I'm gonna tuck it under my patient without touching the patient. Next, I have this. Is just a secure thing, just to go over to provide more privacy for the patient. So this I'm going to place over the patient perineal area, all right, without touching anything on the patient. All right. Next, I have my iodine pack and lubricant and saline. I'm going to open my normal saline, my lubricant, and what I like to do is I put it inside here and then trash. Next, I open my iodine packet. Just to leave it stay like that, and trash the other part. I'm gonna lift off the top of the tray a little bit, off the top of the tray, exposing my Foley tubing, just to get my Foley tubing, exposing the Foley tubing. See, I'm not touching nowhere else but my sterile film. I'm gonna be taking this. I'm gonna be taking this off the tubing. Trash. Just exposing just the tip of the Foley. Then I'm gonna place it right into the tip of the Foley, right into my lubricant. I can have it sit there for a little bit. What I like to do is take the tip off my saline syringe, and I'm gonna put it on top of right here for now. So my field is still sterile. Next, I'm going to take my iodine syringe, iodine swab I mean, and clean the areas. So I'm gonna clean the left side first and then the right. So I'm gonna leave it like this. You know what, let me have them half hang out a little bit. Hold on. check off the other side. Just to have them exposed so I can get to them. All right. Just have them exposed for a little bit. Okay. All right. Next, I'm going to be holding my patient's labia. On my patient's labia, it's apart with my left hand. So this hand is gonna be my dirty hand because I'm touching the patient. I open the labia. Next, I'm gonna take my iodine packet, left side, trash. Right side, trash. Then down the middle, trash. Next, after that, I'm gonna grab the Foley, inserting my Foley into the ureter. I'm gonna push the catheter all the way until I can get I see urine flowing inside the catheter. Once there's urine flowing, I'm going to push it an inch or two more. Once I do that, then I'm going to secure it with my finger and then inflate the balloon with the sterile water. Slowly. 10 cc's. Once that is done, then I'm going to remove the syringe, put it aside, and then I'm going to release it from my fingers and pull back on the tubing until I get a resistance. See? Resistance. Then, once that is there, I'm next going to secure the catheter to my patient's leg and then take the bag out, and I'm going to be hanging the bag on the side of the rail. Not hanging it to the ground, but on the side of the rail. Once that is all done, also, there's a thing where you can even secure it to the bed sheets as well. Once that is all done and it's all secured to the patient's leg, I'm going to clean my patient. Clean, Miss Davis, I'm going to clean you up. Now all my dirty, so I can touch everybody. I'm going to clean my resident up. Get rid of all of these things here. Like that. And then all of these can be disposed into my biohazard bag. Get biohazard bag per agency policy. And I'm just gonna clean my patient up a little bit, get rid of that iodine, and I can get rid of this under her. Put her knees down, legs back together. Cover my patient up with her blanket. Cover my patient up with a blanket. Put the bed down, and I'm gonna wash my hands. And provide my. Here you go, Miss Robert. This is your call button. If you need it, I really appreciate your patience and your understanding for today's procedure. And I thank you so much for allowing me to perform this. And if you need anything else, you can call me. You can put your call button. Somebody will be in to help you. Thank you so much. Have a nice day. Bye.